Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
Tracy, after all of my years working in the emergency room, you'd think that an ambulance and sirens and those flashing lights wouldn't bother me, but it still does.
It does.
It does. I know I see an ambulance and my heart rate goes up, and I'm sure my blood pressure goes up, and I guess it's because you sort of know what might be inside and the tragedy that might be inside. So the question is, and I'm sure a lot of people ask, who's in that ambulance besides the victim, and what are they doing?
Emergency medical technicians, or EMTs, and paramedics. That's who's in there, Tom.
Thank you very much.
They provide first-line medical or emergency care for sick and injured people while they're being transported to the hospital for care. They typically operate in teams with one person serving as an emergency vehicle operator, the driver, while the other gives life-saving emergency care to the patient while they are on their way to the hospital.
Well, recently, a Mayo Clinic paramedic was honored in the nation's capital for her work as an emergency responder. Angela Jarrett received the Stars of Life Award. Is it star or stars? Stars?
I think it's plural.
Angela Jarrett received the Stars of Life Award from the American Ambulance Association. She's with us today.
Here to discuss the life of a paramedic is Angie Jarrett herself. Welcome to the program. It's nice to meet you, Angie.
Thank you for having me.
Angela, great to see you. The lights are flashing, the siren is on, you're on a code 3. What's going on in there?
Well, it can be an array of different things. When kind of start to finish for the call. So when we get paged to a call for service, do I need? Yeah. Okay. Do you want me to start over?
Yep, start
okay.
again.
Good thing we're not live.
That's right.
It would be horrible. You'd be fired. So start to finish from a call for service, from the time that it comes into what we call a PSAP, or a primary service answering point. And the 911 dispatcher takes the call. And here at Mayo, we have emergency medical dispatchers. So they are trained in emergency medical services, as well as a lot of them are EMTs as well. And so they'll take the call and kind of triage through the call and then dispatch the ambulance to where it needs to go. And then they will dictate whether it's an emergency run, whether we go lights and siren and respond to the call, or if we should drive routine. And then once we get to the call, you're right, it's two of us, and it's either a paramedic or paramedic EMT.
Tell me again, what's the difference between the two?
So an EMT, or emergency medical technician, it's a 160-hour course.
Okay.
And then it's a classroom course, as well as at the end of the classroom, we have to take what we could refer to as our boards, and it's the National Registry exam.
Okay.
So that's done at a Pearson VUE Test Center. And then we also take a practical exam. And so in order to be an EMT in Minnesota, you have to take these National Registry boards. And to be a paramedic, paramedics have to already be an EMT to get accepted into a paramedic program such as the Mayo Paramedic program. You have to have your EMT, and then that's a 2-year program.
Okay.
So it's an associate degree.
So the PMT is better trained. The paramedic is more well trained than the EMT. So is the EMT usually driving and the paramedic in back, or not necessarily?
It's if there's advanced life support that needs to be provided, the paramedic will transport in the back. So paramedics can perform interventions such as push IV medications, like cardioversion, pacing, more advanced techniques, where the EMT is limited to being able to administer oxygen, some medications like albuterol nebulizers, EpiPens, but anything more advanced related, cardiac, for example, we can interpret cardiac rhythms and treat those. So
you said cardioversion? What does that mean?
Yeah. So what that means is, like if a patient's heart, they're conscious and awake and their heart is beating way too fast than what it should be, we can actually administer an electric shock to try to convert that back to a normal rhythm.
So there's a lot of paramedics in the whole country, and you, even though you don't want to talk about it, are the best. You are the best paramedic because you won the Stars of Life Award. How did that come about?
So I was nominated by one of my peers for some of the work that I've done over my career in EMS. I'm very involved with rural EMS and volunteer EMS as well, which is predominantly what we have in rural Minnesota. And so right now I work at the site of Plainview, which is a town of about 3,200 people just northeast of here. And they had a really struggling ambulance service. And a couple of years ago, I took on the role there. And we worked on recruiting volunteers, which is pretty difficult nationwide right now. And providing education. We used our Mayo Clinic education that we receive here at Gold Cross and provide that to the EMTs in Plainview. And so it helped with our recruitment. We're providing a higher level of care that way. And we're a pretty successful, striving service today.
And so your coworker thought that you deserved to win the Stars of Life Award.
Yes, evidently. I feel I was just doing what I was hired to do, and we went from 9 active people to 30. So
in the city of Plainview.
Yeah.
So, but all of those people who are in the ambulance, volunteer or otherwise, have been through a training program, 160 hours, you said.
Yep, 160 hours is the classroom portion, and then there's on-the-job training too. So it teaches you the fundamentals of being an EMT, but when you're actually in the back of the ambulance, there's no textbook. You can't just follow it. Every patient is so different that you have to use critical thinking, if you would, critical thinking to decipher in the moment what needs to be done.
Do you still go out on calls?
I do.
Tell us about one of the most exciting ones you've been on lately. The accident's the worst, right?
Yeah, we'll save that for the young ones. Just kidding. In there, I enjoy a medical, cardiac, anything. I guess they're all so different. Truly, I look at it as people are calling us on the worst day of their life. This is no matter if it's a hangnail, I like to think that's maybe not the worst day, or they feel like they're going to die. They're all rewarding and gratifying, I guess.
But you said before we got started that as you were preparing to come down here for our interview, somebody called in. Someone was going into labor. That's an exciting time to be working as an EMT.
Yes. And I actually, in my 16 years, have never delivered a baby. I kind of live a little side story. My husband was a police officer for 12 years, and he's delivered 6 babies. And I would come after him in the ambulance in time to catch that placenta.
Well, you stick around.
Yes, I'm in his shadows. But so
stick around. I'm sure it will happen.
Yeah.
Now, who is it that decides when the helicopter ought to go for a traffic accident?
Yeah, so we have at Mayo Clinic, we have what we call auto launch criteria. And so when that call comes in, so if a traffic crash, for example, if we know there's an ejection or it's at high rates of speed, when that dispatcher gets that call for service, then they will automatically call for the helicopter to come. And so sometimes we don't need them once we get on scene, but we try to get them rolling right away so that time is really of the essence, especially with trauma patients. We need to get them to that definitive care, or sometimes it's an operating room too.
I don't know whether you've noticed this, Tracy, but it seems to me like the ambulance, police, all of these protective services seem to drive more sanely than they used to. I think there was a time when you sort of said, they're going to have an accident on the way to the hospital. But I have noticed that you've slowed down. You're very careful at intersections, and there's sort of a learning curve there, isn't there?
Yeah, absolutely. And it kind of circling back to that emergency medical dispatcher. And them dictating of whether we're going to respond emergently or not, is based on what comes in. Is this truly something that we need to go lights and siren to, or is the public better served by us going routine and having a safer response? And that's really been at the forefront, is safety all the time. We're always reevaluating our safety measures, so you won't see us transporting a lot lights and siren or going out a lot lights and siren anymore.
Yeah, that's good. That keeps my blood pressure down too.
Yes, well, and ours too, really.
Yeah,
I mean, because
exactly.
It only adds to that stress. And so.
All right, we are talking with Angela Jarrett. She's a paramedic and recently was awarded the Stars of Life Award in Washington, D.C. We want to hear more about that, and we'll talk more about being a paramedic, but after this short break.
When we come back, we'll discuss Angela's role in mentoring other paramedics and being an advocate for the profession.
Cool.
All right, cool. Go right ahead.
Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
And we are with a paramedic. And she's not just a paramedic. She's the winner of the Stars of Life Award, which was presented in Washington, D.C. How long ago, Angela?
2 weeks ago.
Oh, good. You're fresh off
Yep,
the award.
just came back.
Did you get a trophy or a plaque, or did you bring it?
Yeah, we got medals to wear around our necks, and then I did not bring it with today. And also a shadow box with a plaque inside of it to keep too.
Very nice.
Pretty cool.
Now, one of the things that you wanted to talk about when we reached out to you and said, do you want to come in and talk about being a paramedic, is you want to talk about getting others involved in being paramedics. And so that was a trade. We said, fine, deal. You can tell us about that. And is it really that critical, that the shortage of EMTs and paramedics?
Yes, absolutely it is. And not just for us in the Rochester area and rural Minnesota, but nationwide. The education requirements have increased for EMTs as well. It used to be back in the 70s and 80s, even the early 90s, you would just sign up and join your local ambulance service, and you would run
with
on your
little or no training.
Yep. Mm-hmm. Basic first aid, essentially. And the term ambulance driver, that's really what we did. And today, it isn't what we do. We are clinicians, and we provide patient care. And so with that comes a lot of education, additional training. They just lowered our education requirements. We had to have 72 hours of continuing ed every 2 years to recertify, which is a lot.
Wow.
A lot. And they just dropped that down to 48. But it's very specific in every category that we have to have continuing ed in.
So even, like you said, the small towns, I was saying that in my hometown in South Dakota, it's less than 2,000 people, and there is always a shortage. I think there is just a standing ad in my hometown paper, please consider being an EMT. So how is it that you are encouraging people to do that, especially in the rural areas of the country?
Yeah, and a lot of it's through education and getting ourselves out there. I mean, we literally went knocking door to door. We're handing out flyers, talking to people, telling them this is what we do, this is what we're here for. And you just get there's some people that just aren't made for that. They're not cut out for it. When we're running.
Well, it makes them sick. Yeah, I understand that. Sure.
Yeah, absolutely. And then there's others that say, I want to help in my community, I just don't know how. So we do try to get out there and offer this. I kind of lost my train of thought.
Yeah, and there's certainly a lot of job security in doing this, right? I mean, if there's a huge shortage, so the hours. I mean, tell us about the hours.
Yeah. So, for example, the site that I serve is Plainview. We have a minimum hour requirement that they have to offer 80 hours over a 2-month period. That can be in any duration, but they have to offer those amount. And so you can work 24 hours straight, you could work 12 hours straight, you could work 5 hours straight. For us here in Rochester at Gold Cross, we all have set schedules. And so we work 12-hour shifts and do 3 12-hour shifts a week.
Do you go and speak with students, like kids that are just maybe interested in healthcare? I mean, is that something that you do as well?
Yeah, that is a big part of the outreach as well. I personally have gone to some of the local high schools and talked during their healthcare, their career days at school, and explained this is what we do. It's not always blood and guts, and it's not always the fun, the hip, the awesomeness, but sometimes it's about just being with someone and being able to provide that first on scene care that they need.
Does the dispatcher let you know whether it's a code 1, 2, or 3? Do you still use codes?
Yeah, so we here at Mayo Clinic now use priority numbers. Okay. So we'll say priority 1, priority 2, or priority 3. And so, we'll say we drove in code 3, and that infers that we drove lights and siren the whole way. Priority 1 means, we need to get there right away, use lights and siren. Where priority 2 means, we need to dedicate right away, but maybe let's go routine and have a safer response that way. And then the priority 3 is maybe something that's been scheduled ahead of time.
Has the ambulance you were riding in or driving ever been in an accident?
Yes.
Were you driving the way that you just responded?
I was. I was driving. I was on Highway 52, and my partner and I had just signed on for our shift for the morning, and a car in front of us decided to make a quick U-turn on Highway 52 in between the concrete barriers. So we were able to come to a stop, but the car behind us
Oh.
didn't.
Oh,
And
hit you.
yeah, and they hit us, and fortunately we were okay, but we were able to render aid to them and help them.
I
Oh, so
guess.
yeah,
If there's
you
going to
see
be an
what I did?
accident, at least
Yeah,
it's a good
the
situation.
silver lining, I guess, that we could help them. But yes, that was the one.
So
time.
your ambulance wasn't disabled, and you could drive the people that were hurt in the car
we
behind.
couldn't drive it. It wasn't drivable, but
my
we were
gosh.
okay enough that we got out and were able to help them right away then too.
So, what is it that the final message that you want people to know about maybe considering? Does everyone that starts off as an EMT become a paramedic, or do you have some people that just remain EMTs and that's all the further they want to go?
That's a really great question. And EMT right now, too, is really a gateway to a lot of other healthcare careers. We get a lot of recruitment through like nursing programs. Sometimes people that are pre-med going into the PA program will say, I took my EMT. Can I use it here as a job? And so not everyone goes on to become a paramedic. At Mayo Clinic, we have a paramedic program that's been very successful, and we try to encourage people to go that way, but sometimes they choose not to.
So it can be a stepping stone to a different kind of healthcare career.
Absolutely.
You ever get bored?
Never.
Really?
Never.
So if you're not on a call, what are you doing?
So for me, my role is I'm an assistant supervisor, so I run the Plainview site, and so there's billing that needs to get done. There's constant, checking of supplies, education, training. We're always doing something. In our downtime, we're pulling out the mannequins and practicing and preparing for what that next call might be.
How long does it take you from the time that the call comes in that you're on the road?
Well, we like to say within a minute. That's our goal, with that we are out the door. Here in Rochester and all the Mayo Clinic sites, we have a 1 minute. Within 1 minute, we're rolling.
Yeah, that's pretty good. So it's
amazing.
a great career. You can be an EMT or a paramedic, and you can go from there and do lots of other different things. Be a nurse. I know a lot of medical students who worked in the summer as an EMT, and they said it was a great experience.
Yeah, it really is, and it teaches you leadership. When it's us in the field, there's two of us. We have decisions that need to be made, and we're able to do that. And the other thing that I didn't mention before, too, is the community paramedic, which is kind of a new and upcoming thing. We just passed a bill, too, and the governor signed it, that in August we'll be able to have community EMTs as well. And these are people that are kind of like, how would you describe it, like community health does, but more. And so when, like, for example, if a patient's discharged from the hospital, comes home, and let's say they live alone and maybe needs that extra help, the goal is to not get them readmitted to the hospital. So we want to prevent them from needing to be readmitted. So what can we do? A lot of times diabetics, for example, may need to take a lot of ambulance rides, and we unfortunately don't have a frequent flyer program for them. So the goal is let's keep you at home. Let's get you involved in your healthcare, and what can we do to keep you here, to keep you healthy. And so that's something that I think that is kind of the future of EMS as well, that we're going to see more of too.
Good.
Well, you and your colleagues do a lot of good for a lot of people, and we're so glad to have you on the program. Award-winning paramedic Angela Jarrett, thanks for being with us.
Thank you.